recently have had surgery or about to go through surgery, so we've put this information together to help. In the following presentation, you will see real patients changing and emptying their stoma bags to give you an insight into what's involved.
My name is Karina Blake and I've had my stoma since 2001.
I'm Caroline and I had a stoma 4.5 months ago.
My name is Riza Karim and I've been wearing a bag since 2001.
My name's Deanne and I've had a stoma for 10.5 years.
My name is Christine Hayden and I've had my stoma for nearly 18 months.
It's a life-changing experience, and therefore when you go through the initial process you'll find you are doing something new. There's a fear of unknown you're going through, but once you get used to the process then it's just a routine really. There's nothing to worry about.
I think once I had acknowledged it was time to have the surgery and it was a fact and it was going to happen, I think I'd set off in a positive way that I was going to get over the surgery and I was going to get better and return to as normal a life as possible.
Now that I have the stoma, it's just part of me.
There's nothing that I did before that I can't do now.
Your ileostomy will need to be emptied several times in a 24-hour period. This can be dependent on what you eat and drink. Most patients find it convenient to empty their bag every time they pass water.
As soon as you get up and go to the bathroom, you need to empty it. I do usually get up once in the night as well, mostly to spend a penny, but generally when I do that, I usually empty the bag as well.
Emptying a bag is very easy really. It takes about a couple of minutes really.
I line the toilet with loo roll. I have some spare pieces ready to wipe the end of the pouch. And it's just really a case of getting yourself organised before it happens.
You sit on the toilet just the same way as you're spending a penny, and then you can empty the bag, open the bag at the bottom, generally between your legs, and let it pour into the toilet. Clean it up with some toilet paper and then roll it and seal it, and that's it.
You may also wish to try different stances while emptying, such as standing up, kneeling, sitting sideways on, or straddling the toilet. All types of bags can be safely secured to avoid leakages. And always remember to wash your hands after emptying your bag. There is no right or wrong way to empty your bag, and it will take time to find your own personal preference. Every 1 to 3 days, your stoma bag will need to be changed. You may wish to do this as part of your morning routine, so that you feel fresh for the day ahead. Some stoma patients prefer to stand over the sink to change their bag. Alternatively, you may find sitting on the toilet or standing over the toilet more comfortable. Remember, in time you will find your personal preference. Whichever way you choose, ensure your bag has been emptied before you start. You need to think carefully and logically about what you're going to do before you start to change your bag. For example, when you take the bag off, where are you going to put it? A disposal bag is the most convenient way, so get that ready. Make sure this bag can be sealed or tied. Then it can be safely disposed of in your domestic rubbish. Other essential items to have close by are a fresh bag, warm water, and wipes or kitchen towel. It's not unusual to have a bit of blood from the edge of the stoma. Stomas are as individual as the people who have them. Don't worry if yours doesn't look like this, as long as it's pink and functional. You will need a closely fitting bag, not too tight, and you will need to check at regular intervals that it fits properly. But don't worry, your stoma care nurse will explain all of this to you. Should you encounter any problems with the care of your stoma, please seek the advice of your stoma care nurse, who will advise you on the use of any additional products.
I change my bag just once a day in the mornings because it's just nothing nicer than having a nice clean bag on after you've had a shower. I just think you've got to be really organised and have everything that you need beside you.
This is what I call my bum bag. It's just a makeup bag, and inside my makeup bag I have wipes, scissors, I have a little water spray, a couple of spare bags, scissors to cut my hole. So everything that I need is there, so I can change my bag, I can clean myself, and I can dispose of everything. And it takes me 2-3 minutes.
When I first started changing my bag, it took me maybe half an hour to change it. When you first have your stoma's quite large and it reduces in size, and you haven't got your bags cut out to the size that it should be. But once it all settles down and you know the right size to use, then it's really pretty quick. I mean, it takes not very long at all.
Some patients experience reddening of the skin on removal of the bag. This is not unusual and will quickly disappear.
I stand at the sink and remove the plaster. I usually use the kitchen rolls, clean the area where the plaster has been, clean the stoma and let that dry completely, and then reapply a new bag. It doesn't take long. It's really very easy to cope with.
There are various ways of removing and reapplying a new bag. Try different methods until you find the most comfortable way of doing this. As with everything, practice makes perfect. After changing, seal or tie your disposal bag and place in your normal household waste. And always remember to wash your hands after changing. There are lots of different types of connectors for a two-piece bag. Basically, you get a flange or base plate and a fresh bag. After cleaning and drying the area around your stoma, first change your flange and then apply your new bag. One of the advantages for the two-piece system is that different bag sizes can be applied. For example, a small bag can be used for sports or more intimate moments.
First and foremost, just be very organised. Make sure that you have your disposal bag, that if you're going to use a two-piece, that you've got it cut ready, placed in a handy place, and dry wipes ready for use. And if you're organised, then it's not a problem, and it certainly gets quicker as the more expert you become.
We have shown you how to empty your bag, which will need to be done several times during the day and possibly at night. We've also shown you how to change a stoma bag, which will need to be done every 1 to 3 days depending on your personal preference. Hopefully, seeing this done by real patients with real stomas has given you some ideas and extra confidence that it is straightforward.
I was quite surprised how quickly I felt better.
Just got confident, much more confident in my lifestyle, confident that I can go out and about and do whatever I want to do.
I play tennis and have done pretty much. I got back to playing tennis fairly quickly, and actually playing golf fairly quickly.
I can wear whatever I want to wear as well. I thought I was going to have to wear sort of like semi-maternity clothes to hide the bag and that everybody would see it, and people don't even know.
Don't worry, don't be frightened, because you get plenty of support and you'll find that your life will gradually open up again.
It's part of your life now, really. You just know that there's some extra duty you have to perform, is to changing your bag and managing it. Otherwise, you don't notice any difference, really.
I can go out for meals, I can go anywhere. I can jump in the car and nip off shopping wherever I want. I just don't have any problems anymore. I can do whatever comes along.
All the bag has done is given me a life. It's made me able to live. I've been able to go out with my children. I can go to the Christmas pantomime. I could go to the schools and see the teachers and not have to worry about whether there was a queue or whether there was 20 people around, or where the toilet was, whether it was clean, whether it had toilet paper. All those worries have gone, and I've got a life.
No, I really honestly can't think of anything that I can't do that I would want to do.
I'm sort of a new person, and it's all because of the bag.
It may be daunting at first, but in time you will become the expert. Should you experience any problems, please be assured there is advice and help available from your stoma care nurse, various patient support groups and company helplines.